Hi, I'm Nancy Clark.
And I'm Anne-Marie Wallace-Phillips.
We're the Hospice and Bereavement Coordinators for VO in Oxford, and this is Morning Chats with Anne-Marie and Nancy. Cheers, Anne-Marie.
Cheers, Nancy.
Today we're going to continue our segment on hospice palliative care and chat a little bit about the differences between curative care versus hospice palliative care. So the purpose of curative care is to provide active care to an individual with the intent to cure a disease or promote recovery from an illness or injury or impairment. So two examples of curative care are chemotherapy to treat cancer or physical therapy to recover after joint replacement surgery.
Right. Whereas hospice palliative care focuses on providing comfort, reducing symptoms and distress, and providing opportunities for meaningful experiences, personal and spiritual growth, and the best quality of life. Hope becomes less about curative and more about living life as fully as possible.
So hospice palliative care takes a positive, open approach to death and dying and encourages discussions among the person, the family, the care team about death and dying and about what the person's wishes are at end of life and what their wishes are for the remaining life that they have. So really that focus on quality of life rather than curing an illness.
Right. Hospice palliative care services are helpful not only when the person is approaching death, but also during the early stages of an illness. Hospice palliative care may be combined with other treatments aimed at the reducing or curing the illness, such as chemotherapy. Many studies have proven that the earlier palliative care is introduced to an individual, the better quality of life the individual can have for the remainder of their life. And also, it also incorporates a lot of more services which are available to help not only the loved one who has the illness, but also family members cope and support each other.
The decision to begin hospice palliative care takes in many different factors. So according to the Canadian Virtual Hospice, ideally, the decision includes a discussion with the healthcare team who can offer more information about options and available support. So there are several different questions that an individual and a family can ask themselves about the type of focus of care and whether it's time for palliative care. So the first question might be, what options are available for treatment? So if someone has received all of the possible treatment options that might affect and cure their underlying illness, then the next step might be to focus on comfort in palliative care. So in this situation, the timing of palliative care is mostly determined by the illness and by its treatment.
Also, what does the person living with the illness want? Some people choose a comfort focus approach right from the get-go. For instance, someone may have several treatment options such as surgery and chemotherapy, but after reviewing them carefully with the healthcare team, and most times also with the family and friends, they may decide against it. In these situations, the timing of palliative care is mostly determined by the patient's wishes.
Another question to consider is what options are available for palliative care or symptom control. So hospice palliative care programs have different criteria for service, whether it's in hospital, in hospice, or in home. And typically, someone who has less than 6 months to live can be eligible. So those are some of the standard parameters for hospice palliative care. This person isn't usually eligible for a formal program if the prognosis is longer than that. However, they still are eligible for a comfort-focused approach. So integrating some of those elements of palliative care.
What is the nature and the course of the illness? The path of a progressive illness, such as incurable cancer, can often be anticipated. With chronic conditions such as lung disease, COPD, chronic heart failure, or when someone has several medical problems but no specific terminal diagnosis, it's really hard to determine terminal stages. Setbacks or complications can happen throughout the illness and may be treatable and reversible. The change of focus can come from the patient or it can be determined by the illness. In such situations, it's best to integrate palliative care into overall health care rather than to choose a specific starting point. Later on in our series, we're going to be talking about advanced care planning. And one of the goals of advanced care planning is to let your wishes be known to your family members. And this is crucial when you have a terminal illness or a palliative diagnosis to let family members know your wishes. And we'll talk about that a little bit later on in the series.
We hope this was helpful for you to have a general understanding of the difference between a curative care approach and a hospice palliative care approach, and also how these two care approaches can work together to support an individual and their family.
Absolutely.
So for more information, you can contact us by phone or email or visit our website, theoinoxford.ca, or subscribe to our YouTube channel to catch up on all of our previous Morning Chat videos. Take care.
Thanks for watching.